The following video is brought to you by Boca Raton Regional Hospital titled Living with Diabetes. If you or someone you love has been diagnosed with diabetes or is living with diabetes, you may be experiencing some fear or uncertain emotions about how do you manage your diabetes. You may be having questions like these and be wondering, what do I do now that I have been diagnosed with diabetes? We hope to give you answers to some of these questions and provide some basic and simple information about what to expect here in the hospital and how we can help even after you're discharged home. Diabetes is a chronic disease, which means there is no cure for it. However, it can be controlled almost to the fact that you may feel like you don't have it anymore, which would be a result of you having it under good control. Let us explain a few important facts so that you can understand your role and how other healthcare professionals can help keep your diabetes under good control. First, let's review how the body gets its energy to function. Whether you have diabetes or not, everyone's blood sugar goes up after they eat. In normal metabolism, anytime anyone eats food, the level of glucose in the blood rises. Increasing blood sugar levels send a message to your pancreas, which in turn secretes out a hormone called insulin. Insulin then delivers the glucose to all the body's cells. 3 to 4 hours later, the blood sugar level returns to normal, getting ready for your next meal. So then, what is diabetes? The definition of diabetes is the body's inability to secrete out enough insulin in response to a meal, and/or it is unable to use the insulin it secretes efficiently. How was my diabetes diagnosed? Well, 70 to 100 milligrams of sugar per deciliter of blood is a normal fasting blood sugar. 101 to 125 milligrams per deciliter is now noted as pre-diabetes. But two fasting blood sugars at or above 126 milligrams per deciliter, this is diabetes. Or another blood test called the hemoglobin A1C is a 3-month average of where all blood sugar levels have been, both before and after meals. The hemoglobin A1C values are also used to diagnose diabetes. 4.8 to 5.9% is normal for someone without diabetes. 6% to 6.4% tells us that your after-meal glucose levels are averaging higher than normal and can also be pre-diabetes. But a hemoglobin A1C level at or above 6.5% indicates diabetes. Do you know where your hemoglobin A1C value is? Many people diagnosed having diabetes say that they feel fine. Unlike other diagnoses might bring you to a doctor or a hospital because you are not feeling well. So what are the signs and symptoms of diabetes? You may have increased thirst, increased urination, extreme fatigue, or in some cases there may be an unexplained weight loss and possibly blurry vision. What type of diabetes do I have? There are different types of diabetes. Type 1 diabetes, which is only about 5% of all people with diabetes, is when your body is not producing any insulin at all, and all insulin must be replaced by you injecting the insulin from the outside. Diabetes pills will not work. Whereas type 2 diabetes, which is 95% of all people who have diabetes, your body is producing some insulin, but it may not be working as efficiently as it could. With type 2 diabetes, diet, activity, weight loss, and oral medications can be used to control glucose levels. What could cause some people to develop diabetes and yet others do not? Does eating too much sugar cause diabetes? No, not really. If you didn't have diabetes and you ate a lot of sugar, your blood sugar values would still return to normal before each meal. Well then, what could cause type 2 diabetes? The aging process. As we get older, your insulin may work less efficiently. Ethnicity. There are certain ethnic backgrounds that have higher incidences of diabetes than others. And heredity. There may be a history of relatives that had diabetes in your family. Taking prednisone or steroids. These cause high blood sugar levels. And being overweight. That can also cause a rise in blood sugar levels. Well, I thought having diabetes was only when a person needed to take insulin. No, some people with diabetes can manage it either by diet and activity, some by taking oral medications, and some may need to supplement their body's insulin by injecting it under their skin, either with an insulin pen or with a syringe and vial. Your doctor will speak to you about what method would be best for you and your health. What we know is that uncontrolled diabetes can cause serious and dangerous complications that affect the large and the small blood vessels of the body and the nerves. Damage to the large blood vessels can lead to poor circulation, poor healing, heart attack, and stroke. Damage to small blood vessels can lead to eye disease and kidney disease. And nerve damage leads to pain, loss of feeling, and muscle weakness in the legs, hands, and feet. Your healthcare professionals here in the hospital can help plan your diabetes management regimen. First, your physician will talk to you or consult a specialty doctor called an endocrinologist to help manage your diabetes. Your nurse and your nutritionist will provide you with some basic important information while you're in the hospital so that you feel more confident about what you need to do to manage your diabetes when you go home. For instance, your meal planning. They can help suggest how to balance your intake of foods that will raise your blood sugar. They can discuss with you what oral medications your doctor may have ordered to also help lower your blood sugars. Or they will teach you how to give yourself insulin if needed. And it is the job of the case manager or discharge planning nurse who will help arrange any assistance or follow-up care that you may need to be discharged safely home. We are all part of your team to help you stay healthy. Please mention to your nurse or to your discharge planning nurse if you have any questions or concerns regarding your discharge home. For example, financial concerns, for supplies or medications, home assistance, glucose meters. We have many viable resources here and in the community that may be able to assist you. Most importantly, know that once you go home, you are not alone. You may need further education and support available at our outpatient, nationally accredited Diabetes Education Center, located right around the corner from the hospital at the Davis Therapy Center. We look forward to helping you manage your diabetes, as well as all your nutrition issues. Let us know if there is anything we can do for you to make your stay with us the best experience possible.